Okay, let's dive into this. Welcome to The Explainer. Today, we're unpacking something absolutely crucial, but let's be real, kind of totally misunderstood. Cancer screening. You hear it everywhere, right? Wellness blogs, the doctor's office, those glossy brochures for executive checkups. But what tests do you actually need? And maybe more importantly, when do you need them? Today, we're cutting through all the noise. We're going to map out the facts and build your ultimate personalized preventive health roadmap. Let's get into it.
So let's start with a question I hear all the time. It goes something like, I feel perfectly healthy. Wala naman akong nararamdaman. Like nothing hurts. Do I really need cancer screening? It's a super relatable question, right? I mean, why go looking for trouble if you're feeling great? Well, here is the secret to preventative medicine. Feeling perfectly healthy, that is actually the exact starting point for true screening. The whole point of screening is to find specific cancers, or even just precancerous changes in people who have literally zero symptoms. So if you're feeling great, you are exactly the person these tests were designed for.
Now, this illustrates probably the most crucial conceptual pivot of our whole explainer. There is a massive, massive difference between screening and a diagnostic evaluation. Basically, screening is for when you have absolutely no symptoms, and the tests you get are based purely on things like your age and your risk factors. A diagnostic evaluation is a totally different ballgame. If you already have symptoms, say a random pain, a lump, something that's just off, you aren't just screening anymore. You've crossed over into the diagnostic phase, and that means you need a targeted clinical evaluation. Wrapping your head around this difference, it changes everything about how you manage your health.
To actually figure all this out, we're going to use this brilliantly clear decision tree today, the Ready and Well cancer screening algorithm. The beauty of this is that it doesn't just blindly list every single medical test under the sun. Instead, it asks you very specific questions to guide you down the exact pathway that applies to your unique biology and your personal history. Because honestly, it's not about testing everyone for everything. It's about screening the right person for the right cancer at the exact right time. All right, to make this super practical, I want you to walk through these 4 mental steps with me right now. This is how you build your personal screening roadmap. Number 1, how old are you? Because guidelines are always shifting as we age. Number 2, what is your sex and relevant anatomy? Different organs obviously need different strategies. Number 3, what's your family history like? Are there specific cancers that run in your bloodline? And number 4, do you have any symptoms right now? If your answer to that last one is yes, remember what we just talked about. You leapfrog the basic screening and go straight to clinical evaluation.
Let's rapidly break down some of the specific guidelines for folks at an average risk without getting bogged down in all the medical jargon. So, for cervical cancer, screening generally targets women aged 25 to 65. This usually means a Pap smear, HPV testing, or visual inspection with acetic acid. Moving on to breast cancer, discussions typically start for women around age 40, utilizing clinical exams and mammography. And for colorectal cancer, both men and women really should start looking into stool-based tests or colonoscopies right around age 45. Now keep in mind, these are just starting points. If your personal risk is higher, these starting ages absolutely can and often do shift a bit earlier.
Okay, I want to pause here for a second because this next point is absolutely vital for avoiding unnecessary panic and fear-mongering. An abnormal screening result does not automatically mean you have cancer, period. This is especially true for things like cervical HPV tests or a Pap smear. Seriously, an abnormal result often just means there's a minor infection or maybe some cellular changes or just an abnormality that simply needs a closer look or maybe one follow-up test. The entire goal here is early detection and prevention. So please, whatever you do, do not let the fear of a weird result keep you from getting the screening you actually need.
And that brings us to a massively important concept, especially when we talk about breast health. If you discover something unusual, don't wait for your next scheduled screening. This is the whole core of body awareness. Mammograms are fantastic, yes, but you know your body best. If you notice any red flags like a brand new lump, changes in your skin, or a bloody discharge, that requires an immediate clinical assessment. You don't just look at the calendar and go, well, my next mammogram isn't for another 6 months, so I'll wait. No way! You take action right away.
Let's clarify some serious nuances regarding 2 other major cancers, because there's a lot of confusion out there. First up, prostate cancer. The PSA blood test? It isn't just an automatic yes for every guy over 50. It actually requires shared decision-making with your doctor, where you weigh the benefits against potential harms, like false positives. Second, lung cancer. This is a big one. A routine chest X-ray does not properly screen for lung cancer. Let me repeat that. Routine X-rays aren't the screening tool here. Evidence-based screening requires a low-dose CT scan, and it's specifically meant for high-risk populations, like people with a significant history of heavy smoking. Which leads us perfectly into a question that patients ask their doctors literally every single day. Doc, instead of doing all these different specific tests, can I just get a panel of tumor markers or maybe just buy that massive executive checkup package to prove I don't have cancer? It sounds so logical, doesn't it? Just draw a bunch of blood, run a giant comprehensive package, and boom, get a printed certificate of perfect health. But yeah, the medical reality is vastly, vastly different from the marketing brochure.
Here is exactly why that test-everything approach just doesn't work. Tumor markers, things like CEA, CA125, or AFP, yes, they are blood tests, but they are not universal cancer screening tests for healthy, average-risk people. They're actually highly useful in specific clinical situations, like, say, monitoring someone who is already being treated for cancer. But throwing your money at a massive panel of these markers when you feel perfectly fine, it does not give you a cancer-free guarantee. Actually, scratch that. It can do the opposite. They can be elevated for totally non-cancerous reasons, which just leads to a cascade of unnecessary anxiety and a bunch of invasive testing you didn't even need.
So, the crucial point is this. Evidence-based screening beats indiscriminate testing. Every single time. I really want that to sink in. Paying for a larger package of tests does not automatically equal better preventative care. Good preventative medicine is highly, highly targeted. Think of it like a sniper rifle, not a shotgun. It looks at your age, your sex, your family history, and it applies the specific, precise tests that are proven by science to actually save lives for people in your exact demographic.
Now I want to take a moment and speak directly to the men and women in uniform. Passing your physical fitness test does not replace age and risk-appropriate preventative screening. You might literally be the fastest runner in your entire unit. You might be fully operationally capable and in absolute peak physical condition, and that is incredible. But cancer risk is tied to your age, your genetics, and your family history. Supreme physical fitness does not magically grant you immunity from needing a colonoscopy when you hit 45. Ultimately, operational fitness does not replace preventive healthcare. Being tough, being resilient, those are core to uniformed service. But taking true care of your health means looking ahead. It means recognizing that you have dependents, a spouse, children, a whole community relying on you. Getting your preventive screenings isn't some sign of weakness or worry. For sure, it's the exact opposite. It is the ultimate act of readiness to ensure you are present and capable for the people who need you the most.
Okay, let's pivot back to something we touched on earlier, because it's way too important to skip over. These are the red flags, the warning signs. We're talking about unexplained weight loss, a new or persistent lump somewhere, unusual bleeding, blood in your stool or urine, a persistent cough, sudden and lasting changes in your bowel habits, or a lesion that just will not heal. Listen, if any of these are present, you do not wait for a screening schedule. You don't wait for your annual physical next year. You go and get a medical evaluation immediately.
Let's move to and see how this all builds together into something you can actually use. Here is your 4-step cancer prevention action plan. Step 1, know your age and your risk, especially digging into that family history. Step 2, get the right screening. Remember, not every test is for everyone. Step 3, reduce your modifiable risks. You know the drill. Avoid tobacco, stay active, maintain a healthy weight. And step 4, never ever ignore those warning signs we just talked about. This right here is a structured, actionable plan you can literally start using today.
I really love the core motto of this health campaign, Ready Today. Well, tomorrow. Knowledge protects, and prevention saves lives. See, cancer prevention isn't about walking around living in constant fear of getting sick. It's literally the exact opposite of that. It's about feeling empowered. It's about knowing your own personal risks, choosing the evidence-based screenings that actually make sense for you, and taking early, decisive action the minute something doesn't feel right.
Which leaves us with one final, incredibly important question to ask yourself. If cancer prevention isn't about searching endlessly out of fear, are you ready to stop guessing and start screening smarter based on your actual risks? Your homework today is super simple. Talk to your family, figure out your history, look at your age, and schedule a consultation to get the targeted, evidence-based screening you actually need. Stay healthy, stay proactive, and thanks so much for joining me on this explainer.